The median age of those who succumb to the China virus is 78 years old. Roughly half of all deaths have been individuals in nursing homes or long-term care. In one study, 90% of those hospitalized had underlying medical conditions, whether it's heart or diabetes, but usually it's some kind of a condition. It seems that people have that, and if they do, it's a problem, no question about it. Young adults may often have mild or even no symptoms. They won't even know they're sick. They won't have any idea that they have a virus. They won't have any idea at all. America's youth will act responsibly, and we're asking everybody that when you are not able to socially distance, wear a mask, get a mask. Whether you like the mask or not, they have an impact, they'll have an effect, and we need everything we can get.
Yesterday you said that wearing a mask was an act of patriotism. If that is the case, why don't you do it more frequently?
Well, I do actually do it when I need. I mean, I carry the mask when I have to go. I went into Walter Reed Hospital the other day. I have the mask right here, and I carry it, and I will use it gladly. No problem with it. And I've said that, and I say, if you can, use the mask. When you can, use the mask. If you're close to each other, if you're in a group, I would put it on when I'm in a group. If I'm in an elevator and there are other people with me, including like security people, it's not their fault. They have to be in the elevator. I want to protect them also. I put on a mask. I have no problem with the masks. I view it this way. Anything that potentially can help, and that certainly can potentially help, is a good thing. I have no problem. I carry it. I wear it. You saw me wearing it a number of times, and I'll continue. Please.
Thank you, Mr. President. Can I ask a quick follow-up?
Go ahead, please.
So are you sending mixed messages, though? Yesterday you tweeted out an image wearing a mask, and then last evening we saw you not wearing a mask at your hotel.
Well, I don't know the hotel. I was pretty far away from people, but I would say this. I've explained it, I think, very well. If you're close together, I would put on the mask, and if you're not, I would say that if you're, for instance, I'll see, like here, you've been all tested, I've been tested. Oftentimes I'll be with people that are fully tested, I've been tested. In theory, you don't need the mask. I'm getting used to the mask, and the reason is, think about patriotism. Maybe it is, it helps. It helps. Now, we have experts that have said in the recent past that masks aren't necessarily good to wear. You know that. But now they've changed their mind. If they change their mind, that's good enough for me. So I wear it when appropriate. Please.
Thank you, Mr. President. Thank you, sir. A lot of Americans, though, may be surprised at your change of tone over all of this, a more perhaps realistic tone. Some would look at it that way. The sudden embrace of masks, social distancing,
well, I've always agreed with that. I mean, I've never fought either one, but certainly social distancing. I want to. That's common sense. 6 feet to me is common sense. I'd like to say maybe make it a little bit further.
The idea that things will get worse perhaps before they get better here, and perhaps the realization that this resurgence, if you will, is for real when you used to talk about it in terms of little fires being put out here and there. Would you
we have them
respond
too.
to that?
No, we have embers and fires, and we have big fires, and unfortunately now Florida is in a little tough or in a big tough position. You have a great governor there. You have a great governor in Texas. You have people that are very, very skilled people, and I think they're going to handle it very well. Their hospital capacities are holding up, but Texas is a big state, and it's very well run, and so is Florida, and I think they'll do a very good job.
Are you changing your tone, though, sir?
I just wanted to ask you about the issue of vaccines, which you already mentioned. Yesterday, a study by a Chinese company showed some promising results for its coronavirus vaccine candidate. If China were first in developing the vaccine, or even if it weren't, would the administration be willing to work with China to bring a successful Chinese vaccine to the U.S.?
Yeah, we're willing to work with anybody that's going to get us a good result. We're very close to the vaccine. I think we're going to have some very good results. We're already in testing. Nobody thought that would be possible. Under the old system, it would be a year to 2 years before you could even think about using the word testing. So I think we've had a lot of, and the reason we're testing, they've had good results. So now we have to see in the testing also for safety, because they have to make sure it's safe. And I think you're going to see something over the next fairly short period of time, maybe very short period of time, having to do with therapeutics and vaccines that are very good.